Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Minimum alveolar concentration, it is also known as MAC. Now the factors affecting. So let's look at the increase in the factors. So first is what increases? Increase in the MAC. So there is hyperthermia. Hyperthermia. So hyperthermia means it is greater than 42 degrees Celsius. Next comes the chronic alcohol abuse. So there is chronic alcohol abuse. And there is acute amphetamine use as well. So what are the factors increasing the MAC? There is acute amphetamine. Acute amphetamine. So acute amphetamine use can lead to increase in the MAC. Then there is also drugs. There will be drugs such as cocaine and the ephedrine. So cocaine as well as the ephedrine. Then comes the hypernatremia. So hypernatremia also are the factors which increase the MAC, hypernatremia. Now let's move on to the factors which decrease the MAC. So all these factors are the one which is increasing. Now what are the factors which decrease the MAC? So factors decreasing the MAC are younger age. So it is a younger age. So by younger age we mean the maximum is at 6 months of age. So it is maximum at 6 months age. Next is the hypothermia. The hypothermia. In factors increasing, it was hyperthermia. In factors decreasing MAC, it is going to be hypothermia. So there is hypothermia. So hypothermia as well as a hyperthermia. So hypothermia as well as a hyperthermia. So this is go up to 42 degrees. Up to 42 degrees Celsius. Next is older age. Next is older age. By older age, we mean greater than 40 years. And the MAC decreases 6% per depot. And MACBC, it decreases 6%. 6% per depot. Next is the chronic amphetamine abuse. So there is chronic amphetamine abuse. So there is chronic amphetamine abuse. And what are the other factors decreasing the MAC? There can be drugs such as the opioids. So there can be opioids, there can be use of ketamine. Next is barbiturates. Then is the benzodiazepines. We are writing it as BZD, and also the sympatholytics. Next, what do we have? There is hypernatremia and the hyperkalemia. So hyponatremia. So in factors increasing, it was hypernatremia. Factor decreasing, it is hyponatremia. Then the hypercalcemia. Next is there is hypotension. So there is hypotension, and there is hypercarbia. There is presence of hypoxia. Then there is metabolic acidosis, as well as presence of pregnancy, as well as the acute alcohol intoxication. To learn and grow daily like this, please do subscribe.